Dr. Alyse Kelly-Jones with Novant Health Mintview OB is here to talk about symptoms, diagnosis, and the impact on women's health. Dr. Kelly-Jones, great to see you. How are you today?
I'm great.
First off, what is Polycystic Ovary Syndrome, also known as PCOS?
Yeah, so that's a mouthful to try and get that all out. And really what I think that the name is a misnomer. I think we should be calling it something like prediabetes, because women who develop PCOS are at risk for diabetes at some point in their life. And it's really a hormonal imbalance that leads to all these kind of weird signs and symptoms. In medicine, when we call something a syndrome, it means we don't completely understand it. And so these are women who have acne, they have oily skin, they will have hair where they don't want it, they'll have infertility, they'll have irregular periods. And does any of that sound like it goes together?
No, not at all.
So it's kind of strange and bizarre, and a lot of times they won't pick up on all these things are related to their hormones.
Right, they just think, oh, well, that's weird, and look at that. Now all of a sudden I'm getting acne, but they don't piece it together. Are there other symptoms, or are those the biggies?
Those are the biggies. Difficulty losing weight is a big one, and this can manifest itself as early as in the teenage years to later on in life even. And women will be like, man, I'm exercising, I'm watching when I eat, I'm on that 1,000-calorie diet, and nothing's happening.
How common of a problem is this?
So we think it's about 10% of women are affected by this, but you kind of as the American diet has changed and it's become more like we're supposed to eat all these carbohydrates, we see it even more commonly now because kids are kind of raised in that diet life from an early age now.
Why is this so hard to diagnose? Is it because of what you just said about these kind of seemingly random symptoms that don't necessarily go together?
Right, so we can diagnose blood pressure problems by measuring your blood pressure. There's not one specific test that we can do on PCOS patients to figure out whether or not they have this syndrome. And the actual syndrome is named after what happens to the ovary, which requires an ultrasound to diagnose, which is not always a part of the whole syndrome. So the whole name is a misnomer.
Is it hereditary?
We're not quite sure whether it's genetic or not, and sometimes you don't know what comes first. Is it the genetic piece or is it the environmental piece that leads to the disorder?
Okay, let's say it's diagnosed. What are the treatment options? What does a woman do?
So the first thing a woman needs to do is change her diet. We all love to hear that, don't we?
I know that's no fun, but...
But if she can, if you think about if you drove a diesel car and you put the wrong fuel in that car, would your car run right? No. So you have to put the right fuel in your Mercedes, right? So the right fuel is a diet that's higher in protein and higher in fat and lower in carbohydrate. And when women are told that, they will lose weight more easily and they won't run around being hungry all the time.
Okay, so change the diet, start there.
And then there are medications that we can use to help the hormone insulin, which is all part of this, will work better. Things like metformin will help women be able to lose weight because it'll help that hormone just kind of work better in the body.
So if somebody out there watching today, Dr. Kelly-Jones, experiencing any of these things, maybe just go ahead and give their doctor a call?
Great. I mean, obviously the web is also a good place to kind of do some investigation, but really their doctor should be able to kind of listen to the history, do a physical exam. There are some physical findings of PCOS, like we talked about the hair. They can also get a darkening of their skin on the back of the neck, and that a clinician should be able to pick up on it.
Dr. Kelly-Jones, thank you so much. If you'd like to make an appointment with Dr. Kelly-Jones, you can go to nhmintviewobgyn.org, the website right there on your screen. You can log on and make an appointment that way if you would like. So good to see you. Thank you very much.
Thank you.
All right, still to come this morning, we'll talk with